Why should a medical practice use social media? It's a question I get asked all the time, and it's one that I hope I'm going to be able to share the answer to in this video. So this is a recording of a recent presentation I did at the Nottinghamshire LMC annual conference, where I talked to a group of GPs, practice managers, and other healthcare workers about why social media from a practice perspective can be an effective tool at helping patients, helping practices, and even managing workload. I know! Well, we're going to cover that for you. This is a live recording of the event itself, and I would love to hear your feedback on the episode and the content. And you can do so by contacting me on Facebook, Twitter, LinkedIn, Instagram, leave a comment in the video, or definitely leave us a review on iTunes if you're listening on the podcast. I would love it if you could click the subscribe button so you get all of our content first and foremost. As always at EGP Learning, we're here to help save you and your patients time by tech enhancing your primary care and learning. Shall we begin?
Thank you everybody for coming to my session. I did a similar session last year and it seemed to go quite well, so they asked me to come back. They're crazy, aren't they? So I got asked to talk about social media, and rather than talking about, I guess, how to use social media individually, which is what I did last year, and I can give you resources to do that, one of the things that there's actually very little information about is how to use social media as a practice. Because when you look at all the gurus and all the information out there that says about using social media for your business, let's remember general practice is a business, it's all about growth. It's all about how to get more business. And let's be honest, we don't have a problem with that. Actually, that's the one thing we don't really need. Most practices are over capacity, have more patients they can deal with, and actually what they want to know is how to make patients flow better, make the day job easier, maybe bring down some of that workload. So I'm hoping in this session, I'm going to show you how we can do that a little bit for social media, okay? So first of all, I'm Dr. Singh Gandhi. I'm a GP that works in Nottingham. I work in St Anne's. I'm a partner, trainer. I also have various representative roles. I sit on the LMC, I sit on the RCGP National Board, and I have about 10 other hats that I've already forgotten, a couple of which include digital stuff in there. So hopefully I've got some standing in terms of talking about this. And as my wife always tells me, I've got the internet plugged into my brain. So I'm afraid I use more internet first and things and stuff than I can probably count to, which was really annoying when my phone got stolen. So you can imagine how painful that was for me. And I'm now back to my backup for now, but hopefully that'll change in a few days. So I'm hoping to show you, first of all, why you should even bother using social media as a practice. Because that's the first thing everyone always says, I don't have the time. Why on earth should I spend time on something that's not going to directly reduce my workload? Well, I'm going to show you hopefully why that's sensible. I'm going to tell you some of the do's and don'ts about using social media, and then also understand the implications of the different platforms, because it is important which platform you use, because they're all different. They completely engage with people in a different way. And then finally, I'm going to give you a flavor of those different platforms, and lastly, some resources to try and save you time and hopefully a bit of money. Does that sound all right? Now, I'm a bit weird. This is one of the first sessions you're probably going to come to where the person actually tells you to take out your phone. Because I actually want you to use your phone during this session, all right? And just so you don't have to worry about taking notes and all that kind of stuff, if you put your phone up to that, as long as it's a relatively new one, it will bring up a link when you use your camera thing that takes you to a web page that has almost all this information on it, okay? If not, the web link at the bottom does exactly the same thing. Next up, I'm going to explain why you should even bother using social media, okay? So in terms of doing that, the first thing is claim your name. And what I mean by that is there are loads of practices out there that do not have a social media presence. And the first thing that you do when you search for them will come up whatever is the highest ranked thing that Google says about you, okay? But actually, if you claim your own social media profile, whether it's on Facebook, whether it's on Twitter, and you're using it, when people put in your name, hopefully, first thing will come up is your practice website. That's what you hope. Second will be the social media profile that you have control over, rather than somebody else. And you're probably thinking, why would somebody else have that? There are examples where people, whether it's other businesses or patients even, have put fake profiles for practices and put information up there as if they're talking from the practice point of view. And that's not a good thing. Yeah. On social media, which we know about, information can fly around like crazy. People use it. If you don't have control of that, you don't have control of it. And that's a worry for me. So that's why I say to people, it's important to have a presence. Doesn't necessarily mean you have to use it regularly, but you do have to use it a little bit just to maintain it. And an example of that, Google yourself. If you're to do that, see what comes up. Because what should come up is your own profiles, which you have control over. And it's no different as a practice. You want to control the narrative about your practice. Next up, it allows you to provide a reference for your services. Now, clearly, this could also be your practice website, and that's a good one to use. How many people actually use websites nowadays? Yeah, particularly the younger, more mobile populations, they go to social media to get their news. I do. I don't bother using the BBC News website anymore. I go to Twitter. It's quicker, faster, and it's live. So people are using different resources to get their information. And actually having a reference that you can use that is on the platforms that these people are using, hopefully means you can educate them better. And that's what I'm talking about in terms of engagement. We know that we have growing cohorts of populations that do not use services effectively. Now, we can talk about the various reasons why. You heard me ask a question earlier about, explain the roles and stuff. Well, we have populations of people that do not understand how to use the NHS, and yet we expect them to use it straight away with no education, no principles, nothing. Yeah. Well, we need to change that, because if we want to make the day job easier, actually shouting at someone that doesn't know how the NHS works is pointless. Educating them about how to do that, you may see more benefit. You may see a reduction in them coming unnecessarily or appropriately, or more importantly, going to the right services at the right time for the right reason. And social media is a method that can allow you to do that. You can create a community. And why is this important? Well, every practice at some point will have challenges that they face. And if you have members of the community that are willing to support you because you've created and fostered that community, that has so much power behind it. My own practice, we've had significant problems with NHS property services, and we tried to tackle it for years. For years, we're still on year 8 now, and we're still going through it. Nothing changed until we went to the patients and told them what we were dealing with. And it was the patients that got behind us. It was the patients that mobilized the community and the counsellors, and that's actually what got people to the meeting boardrooms and stuff. Now, it hasn't resolved, I'll be honest, but it wasn't until we went to the patients that things started to change, because they got behind us and they recognized that we might lose their practice. That has real value. So gaining those super fans, as I like to call them, there's people who do actually value your practice, value the work that you do. Now, yes, you would argue sometimes that tends to be the more elderly population. But actually, if you're not speaking to the younger ones either, how do you know they don't exist, that they're not there to help? It's important to myth bust. So, interestingly, the GMC actually says that using social media is a good thing for doctors. That surprises people. Their own guidance even suggests that you should use it. And one of the reasons it says that is to actually help educate patients about the correctness of health. Now, we know there's lots of myths around health and stuff. We could talk about the anti-vax movements. We can talk about, all the other kind of different ways that people get health information and whether it's true or not, that kind of stuff. But actually, if you are the source of their information for your community, that provides local value, local information that your patients will trust more likely better than other resources. How is that useful to you? Well, particularly from a workflow point of view, if you're explaining to patients, you don't need to come and see the GP for a referral for physiotherapy. Here's how you do it yourself when you injure yourself, or here's the urgent care centre that this is where you should be going for when you have an injury that might be a fracture because you need an x-ray potentially. It's better navigation for patients. It's better engagement, better awareness. Yeah. And lastly, you can notify them of changes. So the reason I put this down, many of you will probably remember a couple of years ago when we had the cyber hack and everything shut down because we couldn't use anything. Emails were down, phone systems were down, access to records were down. It was a nightmare. Having to go back to pen and paper, terrifies me. But one of the things we did, so I basically put out on our social media platforms that we actually couldn't do much for people, to be honest. Yes, we were there able to offer advice. That was momentary advice. If you needed your repeat medications, nah, we're a bit stuck. If you needed your results, not going to happen. We don't have access to anything. Now, how much impact you have varies. But I know after that, we had some patients come back saying, actually, we saw it on your profile. We didn't come in. We came a few days later. Awesome. One less person for a post that took me about 10 seconds to do. But that meant that they had better service because they knew they didn't have to come and take up more of our time. We were already chaotically busy. It just meant things worked a little bit easier. So hopefully that's why you should. But what are the challenges? Well, lack of knowledge. When I started this, I said that there is virtually no information that shows practices how to do this effectively. Welcome. We're going to talk about that. Number 2 is time. Now, time is a real issue. We are already overburdened, overstretched, and struggling to do this. I completely agree. And I'm not going to lie. To do this effectively takes time. But what I'm hoping you'll see is that time invested will mean that you will reap your benefits later down the line. And particularly the community part is something that you cannot develop without investing time. And that's where the real value is. People talk about data sharing. Yeah, okay. Social media platforms have problems when it comes to data sharing. Rule of thumb, no patient identifiable information. Dead easy one. You don't do it. If a patient chooses to do it, that is their choice. That's quite clear in a lot of the indemnity stuff and things. The important thing is that you need, in terms of your responsibilities, you need to try and take that offline from a discussion on the social media platforms. And I'll show you a couple of tips and tools of how you can do that as well. Who should do the work? I'll be honest, getting your GPs to do the work, probably not the best option. Listen to me. But that doesn't mean they can't be involved. And actually, this needs to be a practice initiative. This shouldn't be one person doing it in the back end of the room. This shouldn't be, somebody just having complete control of it. This needs to be a practice initiative. Because actually, you'll probably find there are people in the practice that could do this really, really well, but may just need a little bit of help and support in terms of some other parts. And we'll talk about that a bit later. And then lastly, managing the flow. What I mean by this, there are so many tools out there that can help you do this quickly and effectively and save you time. And again, I'm going to show you how, hopefully. When we're talking about guidance and posting and stuff, one thing to remember, there is actually some good social media guidance out there. So the GMC has social media guidance. It's about 5 pages long. The RCGP has social media guidance for people that want to use social media. It's 10 points. That's good. BMA, it's about 1.5 pages, and it basically says don't post patient identifiable information and you have a responsibility to do this. I like my own personally. It's 6 points. Yep, that's right, 6 points. And basically it just goes around the simple principles about using social media. So number 1 is about sharing. Just consider the information that you're sharing. Do share it and recognize what you're sharing may be of value, but also can be challenging. And also, when you're sharing stuff, just take notice of what's around you. For example, if you're doing this from your clinical room and you're posting a photo or a video, I'm going to explain why that can be useful. Make sure there's no urine pots in the background. Make sure there's no patient notes in the background. Simple little checks like that. Confidentiality leads into that. Again, I mentioned it earlier, no patient identifiable information. I saw patient X today and he told me about all these problems he was having and this is how he made things better for him. This is the reason why this service was great. That's awesome news. Can I mention the patient though? Bad idea. Respect. So respect your own personal boundaries and respect other people's boundaries. So you'll see this in terms of when people comment on posts and that kind of stuff. Remember that people come from different places sometimes, and what you're posting and how you're posting can have value, but also may make them think in a different way. Identity, privacy settings and stuff, massive issue when it comes to social media platforms. And there's a couple of things I can show you that helps to do that. I'm going to strim over this because I've got another resource on the links that you've had that goes through all this in more detail for you. And I'm mindful of time. Boundaries. When you're talking to people, it's important to remember the different roles you might be speaking from. So I mentioned earlier, I've got about 10 different hats that I wear. when I post something, I have to be mindful of that. People may take that to be representative of those roles that I have. Well, I need to be clear if that's the case, if they do cause a conflict. But also from patients. Patients may not understand the boundaries when they're posting on social media because it's so easy to do, so reactionary, isn't it? And actually remember that there are boundaries that we have to abide by as medical professionals, as practices, that kind of stuff. Those rules don't really apply to patients, but helping them understand that, really valuable. And engage. I put this last because it's the one that everybody always forgets and gets fearful of. Because when we talk about using social media in medicine, in healthcare, and all that kind of stuff, the emphasis is why do it, don't do it, it's too scary. But actually, it can provide value. And that's what I'm hoping you'll see. So I talked about safety. And if you're going to do this, a couple of things you really need to have sensibly in place. So number one, have a policy for your staff. According to CQC, you should already have one of these. Yeah. So if you don't, feel free to contact us. I'm more than happy to share them. Okay. But also have a policy for patients. Okay, so this may seem weird. Why do I need a policy for patients? One of the things that we have on our practice website and that I have available for people to use is actually a policy that explains to patients when you're using social media, there are certain things you need to respect. For example, if a patient took a video in your waiting room of other patients, yeah, that's a bit of a, you've got to be cautious there because you may be sharing things that are beyond our control to monitor and observe and that kind of stuff, but you still need to respect those. And similarly, having it for patients that they can't really post us on social media platforms without our consent. Patients can record their clinical consultations. That is different. They can record it for their own personal use. The moment they post that on a social media platform, that's different. That's not for personal use. So having these policies in place, yes, it may not stop that from happening. It gives you that reference point for when it has happened to do something about it. That's why it's important to have these policies. I mentioned earlier about your identity and privacy settings. Social media platforms have a habit of changing their privacy settings to benefit them. Information is valuable. Them having your information, that's why they do this. So checking them on a regular basis, how to check them, have a look at that video. Links in the page that I've sent you. And then if you're going to do this as a practice, as I said, you don't want one person having the keys to everything. So what happens when that person isn't around? You need to do something, you need to change something, then there's an issue. Well, you need to be able to have those passwords stored securely and safely. Use a password manager. It allows you to share them quickly and effectively. My personal preference, LastPass, it's free. I don't pay anything for it, and it works. I can share those with other people in the practice if I want to. I can still maintain master access whilst giving them temporary access if that's the case, or I can share it with a person that also does that role as well. Just makes life easy. And you've got that information stored, secure, and available for when you need it. So I mentioned earlier that if you're going to do this, you need to consider which platforms you want to use, because there's a few. There are different social media platforms that have benefits for different reasons. And I kind of put it as like choosing your car. Some people will like your tiny little Corsa that can work effectively for them and doesn't need loads of storage space, but gets them from A to B quickly and effectively. Other people will need a big 7-seater because that's what works better for them. There is not one platform that is universal for everyone. Okay? So, social media for practices. When you're looking at them, there's a few to consider. Facebook, Twitter, they're ones most people I would imagine have heard of. Anybody heard of GMB? All right, I'm going to come to it in a second. Things to consider though, and I'm going to talk about this before we talk about the individual platforms, but who do you follow as a practice? You may think, why is that important? Well, I work in St. Anne's. There's actually loads of third-party groups and that kind of stuff that provide value to my patients that may have events, plans, campaigns, and that kind of stuff that is useful for my patients to be aware of. And actually, if I can plug my patients into those, that might help them, that might help me. So being able to share that, awesome. Yeah. But in order to know that, I need to follow them to see what they're doing. So, City Care, obvious one for many people in Nottingham. Yeah, CCG, in terms of what they're up to, sharing information that they're doing, that can be useful for patients. So a couple of years back, we had the celiac prescription initiative, that happened about changing the way that those prescriptions would come through. None of my patients knew about it. I put it on our platforms, and actually we started getting some patients talking about it in the practice a couple of weeks later, interested about how that had changed, and they'd said that they'd seen it on our platforms and they got involved in those consultation processes. Local events, midwives, for example, our midwives had an event at our practice about a year ago. No one knew about it. I found out because I saw a social media post. They were doing it literally downstairs in our building in a week's time. And actually managed to get some patients to attend that because they thought it was useful for them by sharing that information. What to share? There's lots of things you can share. There's lots of information you can put on there. Time is clearly a limiting factor. Health promotion stuff, easy, simple. That's really good stuff to share. Service changes, really important to share that. Changes in staff at your practice, that can be useful. Explaining the new roles in practice. Changes to your opening times for PLTs, for holidays. How to advise patients to request their medications early because we've got Christmas coming up and you don't want everybody coming on Christmas Eve to request the medications that they could have sorted out at a better time. Simple things like that. Moderation and complaints. So if you have a profile, unfortunately you're going to have to do a little bit of this. There's no way around it because you do have some control. Does it have to be you? No. Your PPG could be a great resource for this. Getting them involved, getting them to use this as a part of the collaboration between yourselves and your patients, even more powerful, because then the patients also see that they've got some control of that, and that can really be valuable. But in terms of moderation, actually some of these platforms have tools to help you. Useful to use them. But again, this is where your social media policies come into play for when those issues come about. Do you make it that, for example, if you have a page that anyone can post, or do you moderate every post that goes up first? That's a comfort decision for each practice to make. It's based on how much involvement you're going to have and how much control you want. I would argue, make it open, because then you get better discussion, you get better engagement. But again, it's an individual discussion for the practice to make. So Facebook is the largest social media platform on the planet, okay? Approximately 60% of the UK population currently has a Facebook account. That's quite a lot, yeah? And when we think about using it, how can we use it as a practice? Because I could talk to you about how to use it personally, but that's not relevant for this. What you want to know is how to use this as a practice. Well, there's two ways you can do this. You can either use it as a page, or you can use it as a group. And the difference from that is a page is like a notice board. And potentially you could even use this to replace your practice website if you wanted to. I wouldn't recommend it, but it can be a great addition to your practice website, because this can be your newsfeed that you update on an easy and regular basis compared to your website, which may take a little bit longer to do all this stuff and more complicated to do. If you're going to do that, recommend you sign up for a business account. They are free, but they give you more tools to allow you to do this, particularly in terms of metrics, so you can see the information of when people are using your page, when they are posting, what kind of content is actually being beneficial, and it gives you tools like being able to schedule later, so you can save yourself time, because you don't have to do it at the time that you want to post it. I would personally recommend the practice consider pages rather than groups. Groups are great for creating communities. So if you wanted to focus on having that community behind you, yes, a group is a better way of doing it. A group will require more moderation time and more involvement to do so. And I would only suggest doing that if you've got your PPG on board with this. As a page, you can share information as best you want. And to show you, I'm going to show you ours. So this is my practice's Facebook page. Now, it will look different when you're looking at this as a normal person. You're seeing the back end, because that's kind of how it works with Facebook. That's my practice. That's my logo. And if I scroll down, you'll see some of our recent posts and stuff. So today, if you didn't know, was Young Carer Awareness Day. So I've got a post on there showing some of the resources and opportunities available to patients that they may want to use. And this links in with the Young Caring Awareness Day campaign that's going on social media right now. So I've got that both on Facebook and on Twitter and other platforms. And you can see we get comments, and you can see that we've got videos up there as well, and various other things. More relevant, some practices might want to know about. Next one, coronavirus. Yay! So, I created this video earlier this week. I put it on there and shared it, and actually this is probably one of the best videos I've done for a while in terms of sharing. But this just basically explains to patients what they need to know about coronavirus and what they need to do, i.e. wash your hands, cough and sneeze into a tissue or your elbow, and don't come and see us. Because actually the guidance is, don't go to your practice. Call 111. If you've had contact, do not infect more people. And trying to share this with people, as many places as I can, is going to be the best thing to try and help us. Now, other practices use that. It's available. You just share it. There are places you can get this content. And I mentioned about the local services around you. Well, Facebook Pages has a section called your Pages feed. So, just here on the right, when you have these tools, you can follow other people around you and see all the posts they do and quickly sending. So that's supposed to, I've got myself. Let's go down to something more sensible. Royal College of GPs, various other pages, our local St Anne's group. I can just click share. That's onto my page, for my patients to see, and they can see that resource. Simple, easy, done. And as time goes on, that community grows. And as that community grows, it gives you a reference point, as I mentioned earlier, to talk with your patients in a different way. And more importantly, capture the patients you may not always be able to capture. That's where the value is. So I know I've got a couple of regular patients. Almost every time I put a post on, they'll like it, they'll comment on it, and they'll share it. And that drives the engagement with my local population. Let's do that, shall we? A new thing that I've started hearing about, and actually I'm speaking to somebody about this next week, is using live video as part of Facebook to encourage even better engagement. There's a practice up north towards Manchester that on a regular basis go live with their PPG onto their page. They have 5 times the amount of people engaged with their platform than I do. It really stokes engagement, and they've got their PPG involved. It's sharing information like health screening advice, changes in services. They're getting their community behind them, and they're being transparent. They've talked about the challenges that they've had with appointments, how to navigate the appointment system better. Awesome. That's the bit I can't remember. I'll come back to you on that. Next up, Twitter. Twitter is effectively a microblog platform. What that means is you make a post and it goes down, and you make another post and it goes down. You can keep doing that. Twitter has a character limit of 280 characters. Originally it was 140, got doubled. The reason it's 140, Twitter was originally based on text messages, which that was your character limit. But actually they've kept to that because you have to be concise, you have to be brief, and that can be really useful. There's a bit of information about the different terminology with Twitter. I'm not going to cover that to my way of time-wise, I'm running a little bit short. But what is relevant? First of all, create a relevant name for yourself. So having a really weird name for your practice, kind of pointless. Mine's Wellspring Knots, because there are actually 2 Wellspring surgeries in the country. There's not 2 Wellspring Nottingham practices, so I'm kind of hoping that works. And try and keep it short. Longer your name, less engagement. But one really valuable tip for using Twitter is the list function. So I'm going to show you that. So when you use Twitter, you can create lists. So similar to what I showed you with the pages feed on Facebook, you create lists of, for example, community providers around you, other practices around you, other national services that you may want to share. And then just by clicking on them, you get to see them. So if I was to go to my Nottingham News one that I have, so this is all the news outlets for Nottingham only. Because actually for my patients, that's what's valuable. and I can just skim through those quickly. Any I like, retweet. It's on my platform for people who are following our platform to see. Quick and easy. You could do that in about 5 minutes a day if you wanted to. The real powerful thing about Twitter is they're really good with their hashtags. And what that basically means, it's like a read code indexing your data, and then you can follow it and find anything based on that. I mentioned earlier, today's Young Carers Awareness Day. That hashtag is currently trending across the country, and any post on that is being shared and liked, and shared and spreading and spreading and spreading. And that could be really useful. One tip I would suggest doing in the Twitter settings, under privacy, there's a part that says you can set direct messaging only to your followers. That's a great way of limiting the inappropriate content that you don't want from patients through that route. Because what you don't want is somebody sending you a message saying, I'm having chest pain through your Twitter account. Don't. At least if it's public, you might hope that somebody else might also see that and say, please call an ambulance. Yeah, but also on the profiles, having simple things like, this account is not monitored 24/7. Yeah. YouTube. YouTube is the second largest social media platform in the country. It's also the second largest search engine in the country, in the world, sorry. And it's really good for information sharing. People laugh when I tell them this, but I teach people how to do Eccles maneuver through YouTube. It's a great learning resource. How many times have you tried to figure out how to do something, gone to Google, how do I fix X? And it brings up a video that shows you how to do it, and you're like, yay, sorted. You can do that for this. How? How to use your inhaler properly. Save your nurses some time. Have a video, or use one of the hundreds already out there, send that link to your patients. So then afterwards, because we know people don't remember things, a sixth of information is all you're going to take in from a consultation. Here you go, here's a text message, or here's a notification in your app or whatever, with a link to the video how to use your inhaler, how to inject your insulin properly, how to use our appointment system properly, creating content that you can then reference and share. Awesome. And I mentioned the coronavirus video I've done earlier this week. It's a reference point. And it will allow you to share information wider than your practice. If you wanted tips on other people to take content from, welcome to take mine. Someone who's slightly better, and I will happily admit this, Abraham the pharmacist. Yorkshire-based pharmacist. He does really good quality health information videos for patients. Really recommend having a look at him. WhatsApp. I bet there's some people out there saying, why on earth is he talking about WhatsApp? I don't want to WhatsApp my patients. And I'm going to agree with you. I'm not going to talk about this for necessarily interacting with patients. However, there are pilots going around the country using WhatsApp video consultations as an alternative to Skype. What I'm actually going to suggest is you consider using this within your practice as a social media platform. The communication, managing your admin, managing your partners, it's a great way of doing that. And as long as you don't put patient identifiable information, awesome. Actually, CQC really like this because they see you dealing with information flow a lot more effectively as a practice. You can respond quicker and more effectively. Awesome. Can also consider, if you did want to do this from a practice perspective to patients, look at WhatsApp for Business. That is a thing. It allows you to set automatic replies. So for example, if someone was to WhatsApp you, I'm having chest pain, this is not monitored, please contact the services if you're having acute systems, we will check this at this time only. Done. Yes? Yes. Mm. Yeah. Mm. No. No. So WhatsApp has end-to-end encryption in terms of sending the information. The moment it gets to your device, end-to-end encryption is gone. That's why WhatsApp is not allowable for patient identifiable information. There are apps that allow you to do that. My preferred one is something called Silo. So that's SIILO. And that does have encryption because the images and the data that you send is stored within the app. You can't access that through any other route. So for example, on iPhones, the images you get sent into WhatsApp are available in your camera roll. That's why it's not encrypted, because the moment it goes to your device, it's off. Right, I've got me warning and I'm a little bit behind. So, question, how do you find something? If you want to search for information on something, what do you do? Google it, yeah? In fact, Google's become synonymous with search. We don't even say you search for it anymore, you say you Google it, don't you? Google is the platform I would recommend practice consider looking at. I mentioned GMB earlier. Google My Business. So Google actually created a social media platform and nobody realized it. And this is specifically designed for businesses. Why? If you were to type in your practice name, commonly you would hope your website's the first thing that comes up. If you notice, if you do it on a desktop, if you do it on a mobile, actually the first thing that often comes up is a map and then lists of services underneath that. And what you'd hope is your practice is probably the first one there. Next to that is loads of information about it. I'll show you what I mean. So, this is my practice, Google My Business page. So this is what you will see apart from that bit. So that won't be there. That's because we're looking at it from my administrator. What you will see is this. So people would have seen this when they've looked for businesses sometimes on Google. You can see where my practice is, photos that patients would have shared or other people would have shared of your practice, information about my practice, the website, how to get to us, reviews. Okay, we'll come to reviews. Address, opening times, contact details, how to get an appointment. But there's more. You can put your products or services on Google My Business that patients can access and see. Why would we do that? We don't sell anything. But we do. We offer appointments. We offer different types of appointments, travel clinics, minor illness clinics. Actually, people can see what those clinics entail. For example, we often have a challenge of people wanting travel clinic appointments the day before they're traveling. Bit annoying. Having some of that information available for patients to see, actually, you need to contact us 4 weeks at least before to have proper coverage. That's useful information to share. It can tell you information such as the times people contact you. So using this for the past few months, I know the busiest time on our phones, according to Google, Google's pretty good at predicting this, believe it or not, is around about 10 o'clock in the morning. It's not 8 o'clock in the morning because patients have adapted to our opening times. And that's when they're trying to search for us because that's when they're waking up to come and contact us. Okay? And, even better, you can have posts and questions. So I'm going to see if I can show you this slightly better. So I mentioned about posting on your other platforms and stuff. You can share information with patients on various different posts and stuff, just like you can on Facebook and things. So the difference with Google My Business is those posts stay live for 7 days and then they go away. After that, they're cleaned off. But it's information you can share. And this is information that the patients will get when they search for your practice. So you can help educate them. And actually, you will get more footfall through Google My Business than any other platform. You saw my metrics. In the past month, 6,000 people have visited our practice website on the Google My Business portion of it, compared to 100 people on our Facebook page, compared to about 70 on our Twitter page. The volume is there, and it will increase and increase because that's what people are using. So Google My Business, I think, is a really easy and effective way for you to deal with things. And the last tip is, so Google My Business has a frequently asked questions section. So based on review information and based on the post that you put, it will automatically use their algorithm to answer questions when people ask a question, either when they're in your practice or when they're on your practice website portion of that. So if they ask, how do I get an appointment? It will either take your reviews information, or it will take the information you put on a post, how to get an appointment, patient education. Quick and easy, you've got control of it, you're educating your patients better, therefore hopefully they're using it better. If you want more tips, I'm afraid I'm not going to be able to go through this section right now. I've got a video that goes through even more tips and resources, how to do this effectively, and how to save you a bit more time. What I will briefly cover is some of the resources I really recommend practice to consider. So if you're going to create all these media content, some of you are probably thinking, I can't even draw a stick man, and how am I going to create all the lovely stuff that goes with this? Because text posts, generally not so great. Post with images, do a bit better. Post with video, even better still. Live video, awesome. The algorithms within these networks will love it. Canva is a free and easy piece of software that goes through your browser that lets you create images effectively and easily. Every single image you've seen in my presentation and everything else is done with Canva. So I really recommend it, and there's virtually no learning curve, and if you did, there's a YouTube video that shows you how to do it. Sharing images. One thing you need to remember, a lot of images have royalty issues with them. So actually, if you go to Google and find an image and share that, you might actually be breaching somebody's copyright, and they could come after you for that. Use stock-free images. Pixabay, Pexels, Unsplash. 3 websites, really good quality images and free to use. Better yet, Canva integrates with Pixabay and Pexels, so you can even use those images directly, saving you a little bit more time. I mentioned about awareness days. There's a website called Awareness Days that tells you when all these campaign days and everything are coming. Have a look at it. It's free. It does limit you the number of days you can look at it in a particular time. You can sign up if you want to. You get access to it for the whole year then. And it even gives you an iCalendar that you can integrate within your practice. It gives you the hashtags, the websites, everything. It does most of the work for you, but that does come with a slight cost. Bitly. You saw earlier I put a really short web link. You can create your own web links with Bitly for free. Why is that useful? When I see patients, I want them to make a comment about our practice, I send them a web link, bit.ly/Wellspring rate 5 stars. Takes them straight to our NHS Choices page, and it gives them the option of also going to our Facebook page and stuff to leave a comment if they want to. A slight bit of NLP in there. I've kind of told them to give us 5 stars. It's allowed. If you want to manage platforms though, so I mentioned about you can use each of these platforms individually. If you wanted to try and optimize that better, TweetDeck allows you to schedule your posts for Twitter at a later time. So you can do, for example, an hour's worth of work on this in a month and set all your posts for the next month and not have to keep dipping in and out to add the content and stuff, saving you time. You can schedule it for later. If you wanted to use multiple platforms, the free option, Crowdfire lets you do Facebook and Twitter for free. Okay? If you want to do more, there's a cost. But that's how you can do both of those platforms at the same time. You could, if you wanted to use Google My Business, which would be my recommendation, but you have to consider other ones. The one-up is the cheapest one. It's not free. I'll be honest, it works about £2.50 a month, I think it is. But that allows you access to Google My Business as well as the other two. The one I use is something called Bubblebox, which is a little bit more expensive, but it works with this as well. So all the images and stuff, I don't have to go looking for them, type it in, done, post, quick and easy. Lastly, if you wanted resources, my GP Learning website and YouTube channel and everything else, all there for you to use if you want to. Completely free access. If you want to, another thing to pick up and get the information. And the next slide is just questions. Hope that's helped.